Our bodies are always trying to heal. To the extent that we allow it. I'm a craniosacral therapist, among other things, right now. But um, what that effectively means is that when someone comes and lays on my table, I sort of imagine their spine as this. You know how we have like an abacus? Is that what they have over there? Where you have the little beads that slide on the little line. So when most people lay down and their problem, you know, shows as a few of these little, what are they called on the abacus, the little beads, a few of those vertebrae. It's like L2, L3, L4. They're like in this sleeping bag, you know, with three guys in it. And they're like, dude, would you move your, like, they're just like, they can't even communicate. Move your leg, your foot's in the way. Yeah, why are we in one sleeping bag? All right, now we get a little movement. And this is about the speed that it happens. And all of a sudden, those three vertebrae go, wait a second. Wait a minute. I can rotate a little bit. There's a little room in here. You know? We're out of the sleeping bag. We're on like a big king-size mattress. There's plenty of room. And then they go, hey, so what is that? What's that? Hit a wall. And then, okay, well now the abacus is moving in a little bit of a bigger chunk, but it's still not flowing the way it's supposed to. It hit the sacrum, it hit the hips, it hit the pelvic floor, abdominal wall, whatever's holding it in place there, right? What's on the other side? Oh, solar plexus, diaphragm, that like, ugh, it's like, oh yeah, right here, ooh, that, ooh. So it's like, so these guys get to moving, but the guys up here are still kind of stuck. This is like above the diaphragm. Why are they stuck? Let's work on them for a second. So here's the diaphragm. Here's your diaphragm. And let's see, here's like your thoracic inlet. Think like the collar around your head here. So in this hand, I've got that collar. I've got that loop, and you're laying down in this hand here. And then in this hand, we've got that your diaphragm, which is connected to you know, like kind of the arc of your thoracic spine, and it's attached in the front. And so yeah, that's what we've got here. All right, okay, we're getting somewhere. So you're like, what's happening? Well, if you have a hammock and the trees are too far apart, and then you lean them together, the hammock goes, ah, right? Without you being anywhere near the hammock. Okay, story about your diaphragm. I use this with my patients all the time. So, you're a squirrel in the woods, and you see a hawk overhead. What do? You don't do what I just did. You don't go. You go. Is it going? But that initial oh, we all have that, and what it does is it tightens your diaphragm. Now your diaphragm, I've still got your thoracic inlet here, and I've still got your diaphragm here, but it's wiggling, it's doing some room. All right, but that's still there. Okay, hold that. All right, good. So now we're down here. All right, and the all this fascia between the ribs. Ugh. So yeah, your diaphragm is supposed to be this big like parachute that like pulls your lungs open and pulls the air in, and when you do that, the parachute floats back up and it just pushes the air right out. But what we do, still got your thoracic inlet right here, right? All right, diaphragm over here, got you. All right, good. So what we do in that moment, even when you guys try to do breathing exercises, right? Someone says, take a deep breath. And you go, right? It's like it feels terrible. It's because your lungs are already like stuck up there. And then it's like it's all pinned into the corners of your chest. Oh, that's the problem. Ugh. And it feels like this whole, whoa. And so you think about like, instead of when someone says do breathing exercise, instead of doing that, what if instead you breathe out first? So you like this, we're gonna go, and then the next breath kind of pulls itself in, because what you did is you took that drum head of a diaphragm. Yours is over here doing this thing, but mine's tight, right? It's like right now, it's like a drum. So you instead of exactly, the birds know. So and watch how much you can just keep exhaling. It seems like, without ever having to take that big gulping breath. When someone goes, let's take a breath, All right, so thoracic inlet, here's your diaphragm. It's nice and loose now. Okay, so now we're just like right here. Let's take this down. All right, so here's your base of your neck down here, and then your head. Your head is like here. So let's see. Is this easier if we think about it this way? Maybe? No, where's the camera? Sorry to jerk you all around the table. I'm sure this is therapeutic. All right, so I got your head in this hand, and then way back here. There we go. I got your tailbone right here. All right. And you're like, oh, it's higher. Yeah, it's anti-gravity therapy, right? So your tailbone is above your spine. All right. Come on, you guys. Chill out. You're good. Whew. All right. Everything's settling in here? Everything's settling in? You're good? All right, yeah. You can chill, you can relax. I got your head here, and you're a little stuck. Maybe that's me, I'm projecting, surely. This little stuck stuff there, just, we'll hold that for a second. It's really stuck down here. Your tailbone right here. Sacrum craniosacral therapy, get it? So yeah, we just weigh them and see, is this slinky working? Is the abacus sliding now? I've mixed up all my metaphors in this video. But now, can we imagine that they're sliding? The vertebrae are like, whoa, let's go toward the head. Whoa, let's go toward the tail. Like, what if your vertebrae were that, like, what if they were that free? They're supposed to be like that. They're supposed to be like that. Like a cat. Cats, you know, ooh, they're all over there. Sorry. Alright. Here's what I'm going to do. I'm going to lay everything down. And it's your body is going to be floating in this hammock of your own creation. Your skeleton is going to be hanging in this hammock of your fascia and your muscles and your soft stuff and all the gooey stuff. And it's going to hold itself in place. Alright, you're not going to need me. I didn't do anything. I just got the pressure off. Normally this is like a 2x4, right? So, okay, yep, that feels about right. So yeah, I'm gonna come out of here, and I'm bringing in your magical supportive fascia. It's just holding you there. Ooh. You can imagine it like swaying in a little like a spider web. You're just like hanging on a spider web. So that, you know, I realized recently that spiders, you got it now, that spider webs are literally extensions of their nervous system. Like, they feel it in the same way they feel their nerves. So is your web clear? It's like, is there old sticks and leaves in it? Like, this thing you haven't addressed yet, this grudge you're holding, this thing you don't like about yourself. You gotta love the whole web. You gotta keep the whole web communicating. And all of our knots, it's when the spider's not clearing the web, and the web starts to stick to itself in a really big systemic kind of way, you know, where this shoulder can hold your right foot or whatever. It's one big web. I have so many patients, you know, they have 20, 30, 40 diagnoses. You have one tension pattern. Everywhere that you feel it, someone will name it for you. But the way your head connects to your feet, it's like a bike chain. It's like it's more flexible than that. It's like a rubber band. But what can't move? What's not moving? Oh, your feet are hard. You have plantar fasciitis. That's what they'll call it. When the rest of the web is pulling on the feet, that stirrup that runs around your foot. And it is. I'm not saying it's not what it is. But when your feet are loose and your elbows aren't, it'll be tendonitis. Like, I passed through so many diagnoses within myself in the last 7, 8, 9 years that if I wasn't in this literal unfurling process where all of the soft tissue is becoming free of the bones around them, and all of the joints are acting in independence, and they're not, the wrist and the elbow and the shoulder, they're not lines connecting like these things. It's like these are points in a cloud of electric water. I have patients come in all the time. My left hip hurts, It hurts when I do this, it hurts when I do that. What about the right one? Like, oh, it's fine. It's like there's no way. What happens is the functional hip that's like still got some movement in it, you feel. The nerves are working, the blood is flowing. The other hip that's so tight and the nerves are so locked up with each other that they gave up giving you any signal a long time ago. Trace that pattern out, they'll replace the hip that's most functional. Look up the Fidelity knee replacement study. It's a 10-year study on knee replacements. I haven't heard about that in the news. I haven't seen any headlines on that one. The paper just came out last week. And what they called a medical reversal. "10 years out, the patients that had them, the patients that didn't have them, it wasn't just that they were equal, it's that it was worse. At worst. Bones don't pull themselves into each other. If I was pushing, I'm pushing into my knuckles here. Bone on bone, as they say. Well, why are they pulling each other together so tightly? What's pulling the bones together? We don't stop and ask that question. We just go, let's replace this part. It's like, imagine you hooking bungee cords around both ends and pulling them toward each other, and then like, let's replace the middle to stop all this tension. Didn't expect this to go this way. There are no problems that are not tension problems. Here's, oh, I got a kidney problem. Oh, it's a sponge that you've squeezed halfway and asked it to soak up all the water. It's like, it doesn't work that way. You think it's diffusing and perfusing and all the things that it's doing when it's like clamped by fascial tension surrounding it? You think the liver works well when we sit on it half the day? Like, effectively. Anyway, I don't want this to become a manifesto or anything, so thanks for watching. And the way we're connected and the way that your body is connected is much, much tighter than you think.